Good afternoon, ladies and gentlemen. This is Dr. Mobi. Welcome you to Lifestyle with Dr. Mobi. Today we have great guest, one of the inpatient directors for the hospital health system, Dr. Asif Masood. We welcome you, Dr. Asif. And before we start, we like to just point out to audience worldwide and national and international that this pandemic has taken a lot of from the frontline staff, which is doctors, myself, and other healthcare providers. And there are at least 10 to 20% infection among healthcare providers, and which is a big number. For us, it is the first line we face this pandemic right head on, and we do our best to save so many lives. So, to give you an idea, right now, the pandemic is really crossing 200 deaths, and which is total confirmed cases of 2934, as you can see on the screen. So, that is a lot of number, but it doesn't speak the volume about the healthcare providers, which is a separate number, and it does not tell how much courage or everybody, all team members, not only healthcare providers, people who clean, who provide us groceries, who serve us, everybody is involved as a team. And we have to really appreciate everyone. It's not just healthcare providers. So with those words, I will start my program. We welcome you, Dr. Asif. How are you doing?
Aslam Kanji, thank you so much for having me. It's always a great opportunity to share experiences and things with you guys. So I'm so happy to be here.
Okay. Tell us about what you do for the healthcare system.
I'm actually an inpatient medical director. So I am responsible for all the admissions in my hospital and the outcome and how they are served, and to make sure that we give the best care possible. And any issues that arise, I have to address. And as you know, in this pandemic, there are lots of issues because this is something that the world has not seen in the past.
Mhm.
Things change every day. I mean, initially we had like 2 or 3 meetings a day
Mhm.
for our healthcare system with multiple stakeholders on it. And so it's a learning experience. And, I always believe that if it doesn't kill you, it makes you stronger. So it's always good attitude to learn. And I think this pandemic has taught us a lot.
Okay, great, great. Thank you. And so, when do you think the hospitals in your area realize that this is real threat and is gonna cause a lot of problems?
Well, I'm in the middle of the Midwest in Kentucky.
Mhm.
So, I mean, fortunately, we are one of the least hit areas in
Uh-huh.
USA, because from the research that I've done and what we have known, that the number of cases is directly proportional to the distance of the international airport from your location.
Okay.
At New York City, there are 3 international airports within 15 minutes. That's why it's hit hard. So
Mhm.
apply this formula of the international airports. So our international airport is a not such a big international, but a very big local airport. We are about 2 hours from Nashville and 2.5 hours from St. Louis.
Mhm.
So our cases are not as much,
Mhm.
but also our governor in Kentucky was very proactive. So he started these stay at home orders much earlier.
Mhm.
So we believe are in a good spot, but still we have our own share of cases because the hospital I work in, because we have a catchment area of 3 states and 7 counties.
Mhm.
So, I mean, all the sick patients, they come to us, and we have seen our fair share of COVID-19.
Mhm. So, do you think the problem with PPE, yeah, I guess, is not a big problem in your hospital? So.
It's a huge hospital. I mean,
Mhm.
huge problem in our hospital because again we were not used to any pandemic. So anytime
Yeah.
we put a pandemic out of our things because now our census has come low all over the USA. We're not in the hotspot. Their census are low because people are staying at home. We
Hmm.
have staffing issues plus exposure issues because whatever cases we have to make sure that our medical doctors and our staff and nurses are safe. So what I did was I employed 6 robots
Oh, wow.
that I brought into our hospital to make
Mhm.
sure that we can minimize exposure to our staff, which is really helpful.
Okay. So tell us what things robots are doing right now.
Like me and you are having a conversation. So what we do is we push that robot inside the patient's room and leave it there. So what happens is that, like, for example, any COVID-19 patient has at least 3 doctors. That's the medical doctor, which is me, because I work as a hospitalist. And secondly would be a pulmonary doctor, and third is an ID doctor. So instead of all of them going and exposing themselves and consuming PPE, which is very low, as you can tell all over USA, because if you go to a patient's room 8 to 10 times a day, you have to change it 8 to 10 times. Your consumption of PPE per patient goes 8 to 10 times. And if you put all the COVID positive patient or rule out patient, you can easily go to 100 times use, which we don't have so much at hand. So I park my robot inside the room. And then with that robot, I can talk to the patient, the ID, the nurse, the pulmonary can talk to the patient, ask all the questions that they have. And also, the cool thing is that that robot also has a stethoscope, which either the patient can put on his or her heart and lungs, or I can have a nurse when she goes in, she puts that in. So I can do a complete with it. I can talk, like, as a medical doctor, there are 4 parts of a note: SOAP, the SOAP notes, subjective, objective, assessment, and plan. For subjective and objective, I use my robots, and for assessment and plan, I can formulate it from outside.
Okay, great, very good. So yeah, that's something new. I've not seen many hospitals are doing. So congratulations, you did wonderful for your healthcare.
Thank
So also, if you can tell us, how do you? I'm sure when you're rounding, how do you keep the staff motivated with all these? Going through all this tough time.
Well, the good thing is that the staff is cognizant of the fact that this is the day why we went to medical schools for. So these things are, if we are going to shy away, then who's going to fight? We are the frontline fighters. So they understand that it's a tough situation, and they understand that we have to fight no matter what we have, no matter what we think, no matter what we feel. So it's also the mental attitude, like, how motivated you are or how fearful you are. I mean, as you know, when you look at the media, there are so many news all over the world, people dying, people getting sick, and all that stuff. But I mean, what I have experienced in my life that you can have pain, but how you react to that pain is up to you. So you have all these things going on. Are you become afraid or are you become motivated? It's all in your hands. I mean, a pain can hurt you, but suffering is in your mind. That's optional.
Okay, so also if you can tell us about what are you doing in terms of you're keeping yourself motivated and going through all this.
There's one thing that I've seen in my life, and I think we all have observed that this too shall pass. All the good times in the world come and they pass, all the bad times come and they pass. So That's one thing I tell myself and my team, this too shall pass.
Okay, very good, very good. And do you think where do you see the future with healthcare? How we gonna manage with all these elective surgeries going down and so forth?
Yeah, I have a lot of issue with keeping my staffing up. So sometimes we have to make sure that we furlough a few of our employees, which is not a good thing because they are already hurting in this economic thing. And if we cut down on their shift, it's also not good. But this is something that we have to do, and they understand that. So basically, it's going to take at least the rest of the year for us to reach back to pre-COVID 19 phase. And we have to go it. We have to, the most important thing is that we have done a lot of sacrifice as a nation, as a team, as a country, as a hospital, as a state, as a community in keeping social distancing for 5 weeks now. So if we open too early, we could be back to square number one. So to make sure that we organize where we can have a plan of reopening based on our local incidents, our testing, and based on our future resources is the most important thing.
Thank you for sharing all that. If you can also tell me about what are you keeping up with the PPE?
Yeah, that's the thing because our ministry was very helpful. Six robots. So, I mean, in the last 2 weeks, I have had a few COVID positive and COVID rule out patients, but I haven't worn a single PPE in the last 2 weeks, thanks to all those robots. So, those robots are really helpful if you use them. And I can use my laptop and even use them from home. So, if a patient is COVID positive, then you have to go inside that room with keeping your mask on, your head shield, your cap, your gown, and all those things on. And when you talk, the patient can barely hear you. With the robot, I can log in, I can take my mask off, they can see my face, I can talk to them. And there was one patient who I talked to 10 to 12 times a day on that robot. So the patient was happy because he had a doctor whenever he needed. And I was happy because me or my team was not exposed to them. And the hospital was happy because we were conserving PPP because in the last 2 weeks, all I have worn is a simple surgical mask. That's it.
Okay. Well, thank you for all that. So, also tell me about your lifestyle changes with COVID, which has brought that changes for you. How you managing it?
Well, I'm an outdoorsy person. I like to walk a lot and run and jog and go to, because what I do is when I work 1 week on, 1 week off, I travel all over the world. And so this has been on hold every. So right now I'm at my home, and it's a good chance because there are so many things have to be done at home. So God has given me an opportunity to take care of stuff at home. So I'm not complaining, because things happen to you. How you take them is up to you. So I'm thankful to God that it's a very tough time, but He has given us opportunity and the knowledge and the courage to deal with the pandemic, as well as for us to look deep into ourselves and see what is really important. Like like all these things that we used to do, like in the last 6 weeks, the pollution in the world has gone almost non-existent because
Mhm.
are staying at home. That's a good thing for the greenhouse phenomenon in our world. Like
Mhm,
we know that we don't need as much to live as used to, which is what our economy is based on buying and doing things and going out, which is very well and good because that's a part of our economy. But as a human being, you don't need a lot. And
mhm,
God has given you whatever things you have. So I think it's a great lesson for us. And if you look from the religious standpoint, whether you are a Muslim or a Christian or a Jew or a Hindu or any other religion on the world, it tells you to spend more time with our families. So in the corporate world, we had lost sight of it. We were barely seeing our family on the weekends, and even at night when we come home, we were tired. So this is an opportunity for us to re-evaluate things, what is important in life, what we are doing, and where we go from there. And I think this pandemic is going to change a lot because the corporate world has seen that things can be done from home, and there's no need for us to travel all over the world for doing those meetings, which it could be done at home. So it would be, I think, by the time this pandemic is over, the world would be changed, and we already feel the change.
mm. And yeah, and I think I shared with the audience before that if this change means we have to share and take care of our family, friends, and make prioritize things which we want to do in life, namely your health, and take care of your close ones, then we are given this nice opportunity to restart our life, right?
Absolutely. So you have to, because there has been opportunities in life, because every single day that you wake up is a new day. Now, if you want to take it negatively or positively, it's entirely into your hands. So, and this is the opportunity from God to take in whatever hand has been dealt to you and come and emerge as winners. So, this is our opportunity to learn and to get back on track and to be the best that we possibly can as a doctor, as a human being, and as a family member.
Okay, great. And so also final, any trips you have for audience in terms of from this pandemic with your expertise in healthcare, for other health systems to learn?
Well, there are three small things I want to share. Number one is that there's no major country in the world who was not dealing with it. So we are all in it together, and whatever we do as a combined human effort is what is needed. So the number one thing that is needed is to stay at home, as the infectivity of this pandemic is the one which is the major factor in determining what outcome we have and how soon we get rid of it. So, number one, as I said, stay at home and make sure. And this is the opportunity. And I don't think anytime again in the world you will have this opportunity to stay at home, reflect on yourself, reflect on your family, and reflect on what good things you can do at your home and change you as a human being. Number two is when when the states are going to reopen, we feel there will be a second wave because the people who are stuck at home, it's like a stampede when you put a few horses and cattle in a barn and then we immediately opened it, they all came and run. So we feel there will be a phenomenon where all the people will rush and they're going to go to watch movies and go to the restaurants, and all we need is one guy who's sick, and then we can get back to square number one and then have a second wave of pandemic. So my request is when the states reopen, take some time,
Mhm.
slow down. If you want to go and have a nice meal outside once a week, that's fine. But no need to going there 2 or 3 times a day. Just go out for minimal things. So take some time bringing the normal back to life. And the third and last thing is that if you have symptoms, please do not treat yourself at home. By there are many things that you have seen on the TV these days. So make sure that you have a medical doctor you have access to. Because first of all, you should not treat yourself in any condition. Anyways, second of all, it's a new pandemic which the world has never seen. And the third of all, even for us who are on the front line, things are changing every hour, every day. So
Mm.
you to take your life into your hands is something that does not make any sense. If you are cautious, if you think that you have contacted COVID-19, the good thing is that COVID-19 tests are free all over USA. You can go to any health shop, or I mean, and you can just Google the testing sites in your area, wherever in USA you are, and you can get your test done. But the thing is that the more panic you will get, the lower your immunity is, and you need your immunity to be high. So make sure that you stay with your family, get your immunity and your life fortified with the help of your family members at this time, and pray to God. And God is here to help you. He is the one who put you in this, and He is the one who's going to take you out of it. Just hang in there, be the best you can be, and do the best for yourself, your family, and for the community that you are in.
Well, that's a great thought, and thank you for sharing all your great wisdom with all of us. So, the audience, you see that we are put in this pandemic, but we as a team can fight, and with the help of all of us, putting so much. When I meet a grocery person, everybody is working 24/7. A lot of work they are putting their life at risk for others. So as a community, we all will thrive. Will get better, and this will teach us definitely new thing, and we as a community will really rise out of this. So with these words, I thank you, Dr. Asif, once again for coming to our show, giving us your take, and take care. Thank you.
I appreciate you. Thank you so much.
Thank you. Thank you.